I am Dr. V. Janaki, Assistant Professor, PG and Research Department of Chemistry, Sri Sharada College for Women, Salem 16. So in this video, let us see what is meant by antibacterial agents and then the mechanism of antibacterial actions. That is, how the antibacterial agents acts against the bacterial cell. First, let us see about what is meant by antibacterial agents. The agents that acts against bacteria are called antibacterial agents. Now we will move on to the mechanisms. There are five mechanisms by which the antibacterial agents acts on the bacterial cell. The first one is inhibition of cell metabolism. The antibacterial agents which inhibits the cell metabolism are called antimetabolites. These compounds inhibits the metabolism of microorganisms. They can do this by inhibiting an enzyme catalyst reaction which is present in the bacterial cell. The best known example of the antibacterial agents that is which is acting in this way is sulfonamides. The next one is inhibition of bacterial cell wall synthesis. It inhibits a cell wall. It leads to the cell lysis and death. The agents operating in this way are penicillins, cephalosporins, and vancomycins, etc. As animals do not have a cell wall, so the animal cells are not affected by these antibacterial agents. And the next one is by interactions with the plasma membrane. Some antibacterial agents interacts with the plasma membrane of a bacterial cell so that it affects the membrane permeability. So it also leads to the death of bacteria. The agents like polymyxins and thiothrysin operate in this way. The next one is by disruption of protein synthesis. We know that the proteins and enzymes are very important for the survival of the cell. The agents which disrupt the protein synthesis includes aminoglycosides, tetracyclines, and chloramphenicol. The next mechanism is inhibition of nucleic acid transcription and replication. Here, these agents prevents the cell division and it also inhibits the synthesis of essential proteins. The agents acting in this way includes nalidixic acid and proflavin. Now, let us see the structure of the bacterial cell and their corresponding drug targets. So here you can see in this slide. So the nucleic acid materials are a DNA and RNA. So and these nucleic acid materials are acted by the antibacterial agents like quinolones and aminoacridins. The next layer, the first layer is present at the bacterial cell is a cell wall. So here the bacterial agents like penicillin, cephalosporins will act on this cell walls. And the next is a plasma membrane. So in this, the antibacterial agents like polymyxins will act on this plasma membrane. And then in the center part, we can see the ribosomes also present in the bacterial cell. So here the antibacterial agents like chloramphenicol, streptomycin, and tetracyclines it used to inhibit the microribosomes that is present in the bacterial cell. And then you can see the sulfonamide is also acting on the enzymes. So these are the bacterial cell and the drug targets. Now let us see the detailed mechanism of each and every one. So the first one is the antibacterial agents which acts on the cell metabolism. Here it is otherwise called as antimetabolized. Here the best example of antibacterial agents acting as antimetabolites are the sulfonamides. It is sometimes called as sulfur drugs. The sulfonamides journey began in the year of 1935 under the name of protonsil. These drugs have antibacterial agents only in vivo. You can see the structure is also in the slide. So in vivo means which is given only, it will act only when it is given to the laboratory animals. And then in no antibacterial agent was observed in vitro. That is, it does not kill the bacteria that is growing in the test tube. So here the proton cell was metabolized by the bacteria that is present in the small intestine of the test animal and gives a product called sulfanilamide. And this compound has the true antibacterial activity. Thus, proton cell is an example of prodrug. After that, the sulfanilamide was synthesized in the laboratory and became the first synthetic antibacterial agent, and it is found to effective against a wide range of infections. Further, it leads to a development of the wide range of sulfonamides and which are proved to be very effective against gram-positive organisms, especially pneumococci, meningococci. The sulfodrugs have proved ineffective against the infections such as Salmonella. This organism is responsible for the typhoid. So here one more drawback of this. Sometimes these drugs are metabolized and give rise to a toxic product. This leads to the sulfonamide being superseded by penicillin. And now let us see the next one, that is structural activity relationship of sulfonamides. So we can see the large number of sulfonamide analogs, but these all must have the following essential requirements. You can see the structure in the slide also. So the para-amino group is essential for the activity, and this group must be an unsubstituted. That is, in the place of R1, it must have an H. So the only exception is that when R1 is equal to acyl, that is acyl amide will be formed. The amide themselves are inactive but can be metabolized in the body to regenerate the again the active compound. Thus, amides can be used as sulfonamide prodrugs. The next one is aromatic ring and then the sulfonamide functional groups. Both are required. Here, both the sulfonamides and then the amino group must be directly attached to the aromatic ring. The aromatic ring must also be the para substitution only. So extra substitutions will also lead to the decrease in activity, that is bisteric. Here the sulfonamide nitrogen must be the primary or otherwise it may be a secondary. So here if you want to prepare a large number of analogs, the R2 is the only possible sites we can prepare the various analogs. So here you can prepare various analogs by using this one. In sulfonamide analogs, R2 is the only place we can vary it and we can incorporate the heterocyclic or otherwise the aromatic structures. And this affects the extent of drug binding to the plasma protein, which in turn also controls the blood levels and lifetime of the drugs. Thus, a drugs that binds strongly to the plasma proteins will be released slowly in the blood and it will be a longer lasting. So varying the R2 can also affect the solubility of the sulfonamide so that we can conclude it that variation of R2 affects the pharmacokinetics of the drug, but it does not affect the mechanism of action. Now let us see about the what are the various applications of sulfonamides. Before the introduction of penicillin, the sulfur drugs were the only choice of drugs in the treatment of infectious disease. These drugs plays a significant part in the world history by saving the Winston Churchill's life during the World War II. He got an infection and was bedridden for several weeks. Fortunately, he responded to the novel sulfonamide drugs. Here, the one example is sulfadoxine. Here you can see the structure in the slide. And this sulfadoxine is so stable in the body that it has to be taken once a week. The combination of sulfadoxine and pyrimethane is called Fansidar, and this is especially used for the treatment of malaria. In addition to that, the sulfodrugs have the following applications. It can be used in the treatment of urinary tract infections, eye lotions, treatment of infections in the mucous membrane, and it also used for the treatment of gut infections. Now let us see about the mechanism of actions. So here the sulfonamides acts by competitive enzyme inhibitors of dihydroterate synthetase and blocks the biosynthesis of tetrahydrofolate in the bacterial cells. This tetrahydrofolate is important in both human and as well as in the bacterial cells because it is an enzyme cofactor and it also provides one carbon units for the synthesis of pyrimidine nucleic acid base, and this base is required for the DNA synthesis. If suppose pyridine and the DNA synthesis block, then the cell can no longer grow and divide. And one more important thing is that the sulfonamides do not actively kill the bacterial cells, but they prevent the cell growth and multiplications. This uses the body's own defense system to gather its resources and wipe out all the bacterial cells. So we can say that it is also called as bacteriostatic. That is, it inhibits the cell growth. Sulfonamides depends on a healthy immune system to complete its mechanism. So these drugs are not recommended for the patients with a weakened immune systems, AIDS patients, and as well as the patients who are undergoing cancer therapy or the patients who are undergoing an organ transplantation. And these sulfonamides are also act as an inhibitor by mimicking the para-aminobenzoic acid. So we can see in this diagram also. So we are just they have marked as PABA. So this PABA is one of the normal substrate that is required for the dihydroterate synthetase. The sulfonamide molecule is have a similar in structure to the PABA that the bacterial enzymes will fold it in accepting it to its active sites. Once it is bound, the sulfonamides prevents PABA from binding. As a result of this, the dihydroterate is no longer synthesized. In this way, it prevents the cell metabolism. So this is the mechanism that is behind the sulfonamides. So now let us see about the next mechanism, that is the antibacterial agents which acts against the cell wall synthesis. Here the example is penicillin. So in the year of 1928, Alexander Fleming introduced the penicillin. The penicillin contains a bicyclic system consisting of four-membered beta-lactam ring which is fused to a five-membered thiazolidine ring. The skeleton of the molecule is proved that is derived from the two amino acids such as called cysteine and valine, and the overall shape of the molecule is just looks like a half open book structures. Now let us see about the various derivatives of penicillin. So this is the structure of the penicillin or that is present in the penicillin will varies depending on the components that is present in the fermentation medium. For example, if you are using the corn steep liquor as a fermentation medium, it contains high level of phenyl acetic acid and gives benzyl penicillin. It is otherwise called as penicillin G, that is R is equal to benzyl. Suppose the fermentation medium contains the excess of phenoxyacetic acid, that is, it gives phenoxymethylpenicillin, or otherwise it is called as penicillin V. Now let us see some important properties of penicillin. So benzyl penicillin, that is penicillin G, is active against a wide range of bacterial infection and it lacks a series of side effects for most of the patients. However, it has some drawbacks. It has a narrow spectrum of activity and it cannot be taken orally because it is broken down by the stomach acids and it has no effect that is particularly on those where the microorganisms is producing an enzyme called beta lactamase. This enzyme hydrolyzes the beta-lactam ring of benzyl penicillin and makes this penicillin an inactive. So benzyl penicillin is active against non-beta lactamase producing gram-positive bacteria. Here the example is meningitis gonorrhea and several gram-negative bacteria also. It is an effective for many streptococcal, pneumococcal, gonococcal, and meningococcal infections. It is also used to treat anthrax, diphtheria, and Lyme disease in children, and it also effective against tetanus. Here, the penicillin is an bactericid. The next one is phenoxymethylpenicillin is recommended for the treatment of such as tonsillitis, rheumatic fever, and oral infections. Some people's allergic reactions will also occur while taking the penicillin. It varies from rash to immediate anaphylactic shock. Now let us see the next one that is beta lactamase inhibitor. It plays a very important role. So here the beta lactamase inhibitor, here the example is the clavulanic acid. The clavulanic acid was isolated from species Clavuligerus by the scientist Beechmans in the year of 1976. Here you can see the structure of clavulanic acid in the slide. So here it has a weak and unimportant antibacterial activity, but it is a powerful and irreversible inhibitor of most lactamase inhibitor, which means that it is used as a sentry drug in combination with the traditional penicillin under the name of amoxicillin. So here, the clavulanic acid is also administered intravenously with a ticarcillin under the name of timentin. The clavulanic acid was a naturally occurring compound in which the beta-lactam ring was fused to oxazolidine ring. Many analogs have been made and the essential requirement for the beta-lactamase inhibitors are a strained beta-lactam ring, the enol ether, the EZ configuration for the double bond of the enol ether. And then here one more thing, that must not be any substitution at C6. And then our stereochemistry, that is a position 2 and 5. And then the next one is a carboxylic acid group is also very important. So the 9th place we're having the hydroxyl group in the clavulanic acid is generally involved in the hydrogen bonding with active sites of the beta lactamase enzymes. Thus, it is called as suicide substrate. Now, let us see the next mechanism, that is the antibacterial agents that inhibits the protein synthesis. Here the example is tetracyclines. The tetracyclines are bacteriostatic antibiotics and it has a broad spectrum of activity. You can see the structure in the slide, and these are widely prescribed antibiotics after the penicillin. It is used for the prevention of malarial parasite. Here, the one of the best known tetracycline is chlorotetracycline. So it was isolated in the year of 1945 from a mud-growing microorganisms. Further tetracyclines includes doxycycline was synthesized. And these tetracyclines inhibits the protein synthesis by binding to the subunits of ribosome and preventing the amino acyl tRNA from binding. This stops the further addition of amino acids to the growing protein chain, and the protein release is also inhibited. Thus, the tetracyclines are capable of inhibiting the protein synthesis, particularly in mitochondria. Here, let us see some uses. So, of this tetracyclines, It is especially used to cure infection in animals, food additives, to increase the growth of newborn animals. And the next we will see that one more example for this tetracycline is chloramphenicol. So chloramphenicol was isolated from a microorganism called Streptomyces venezuela. So here you can see the structure of chloramphenicol in this slide. It is now prepared synthetically and has two asymmetric carbons, and it is marked in the structure also. Here, among this, only the RR isomer is active. So the chloramphenicol acts by binding to the 50S subunit of ribosome and it by inhibiting the movement of ribosome along the mRNA. That is, by inhibiting the peptidyl transferase reactions by which the peptide chain is extended. The nitro group and both alcohol groups are involved in binding interactions. The dichloroacetamide group is also very important, but it can be replaced by other electronegative groups. This chloramphenicol is a quite toxic and the nitro substitutions would be responsible for this toxicity. Now, the next mechanism that is the antibacterial agents that acts on nucleic acid transcription and replications. Here the example is quinolones and fluoroquinolones. The quinolones and fluoroquinolones antibacterial agents are particularly used in the treatment of urinary tract infection. And this is also a broad spectrum antibiotic. You can see the three different analogs, that is nalidixic acid, inoxason, and ciprofloxacin. Here, the nalidixic acid was synthesized in the year of 1962 and was the first therapeutically useful agents in this class of compounds. Various analogs were synthesized. However, a breakthrough was made in the year of 1980s by the development of the drug enoxaparin. This drug showed improved broad spectrum antibiotic activity. The single fluorine atom at position 6 greatly increased both activity and as well as its cellular uptake. Here, the basic substituents such as piperazine ring at a position 7 was also beneficial for the pharmacokinetic reactions due to the ability of the basic substituent to form a zwitterion with the carboxylic group at a position 3. Suppose if the introduction of cyclopropyl substituent at a position further increase the broad spectrum activity, while the replacement of a nitrogen at a position 8 with carbon helps in the reduction of adverse reaction and it shows more potent activity against the Streptomyces RS. This leads to the synthesis of ciprofloxacin, and this is the more active of the fluoroquinolones and it is more active against the gram-negative bacteria. So the quinolones and fluoroquinolones inhibits by replication and transcription of bacterial DNA by stabilizing the complex that is formed between DNA and the enzyme topoisomerase. And then these quinolones has it will be effective against the gram-positive bacteria, that is, it forms stabilized complexes between DNA and topoisomerase 4. Whereas in the case of gram-negative bacteria, the complex will be formed between DNA and topoisomerase 2 enzyme called DNA gyrase. A large number of fluoroquinolones were synthesized nowadays. These agents have good antibacterial activity and all have a similar bicyclic system, which includes pyridine ring and a carboxylic cyclic group at a position 3. The third and the fourth generation fluoroquinolones are synthesized and it includes oflafloxacin, levofloxacin, moxifloxacin, and besifloxacin. So ciprofloxacins are especially used for the treatment of urinary tract infection, respiratory infection, and gastrointestinal tract infection. So levofloxacins are especially used for the treatment of sinus, bronchitis, skin infections, etc. So far we have seen what is meant by antibacterial agents, and we have seen the various mechanism through which the antibacterial agents acts against the bacterial cells. Thank you.